Hello and welcome to another vlog. It's been a minute for those of you new here. My name is Kian. I am a medical student. I'm currently in that awkward phase between first and second year, and my channel is all about making vlogs and sharing a realistic, authentic version of what medical school is really like. So if you want to know more, please subscribe. And anyways, let's get on with the video. So over the next few weeks, I'm going to be shadowing a variety of different surgical disciplines. So I'm making a little table of all the specialties I'm going to be shadowing. And then I'm also going to write down some objectives, questions, and just discussion points, as well as personal goals for each shadowing session. This may seem excessive, but I want to take as much advantage of the knowledge that these surgeons have, and I just want to have some sort of structure in terms of my own personal goals going in. So I just finished all of my thank you cards for the various surgeons that I will be shadowing. I just drew these up on the iPad and then printed them out and wrote thank you on the back. So yeah, those are the thank you cards I will be giving to each of the surgeons after I shadow them. Yeah, I think it's always nice to show your gratitude, especially in the form of a handwritten note. I don't think it's like necessary, but I think it's nice, and maybe it'll come off as like a bit of sucking up, but I don't really care. I think it's better to err on the side of just being nice and showing your gratitude and appreciation, and if at the very least, like, the funny cartoon makes them smile or smirk, then that's a job well done, in my opinion. Good morning. So it's about 6:30 in the morning and I'm heading over to the hospital. This is day number 1 and I'm shadowing cardiac surgery today. Alright, so it is 7:30. I need to meet the surgeon at 8. I'm at the hospital, but I need to figure out where specifically I'm going, which is going to be the hard part because I'm directionally disabled. Hopefully this doesn't take too long. So I just finished my day shadowing cardiac surgery. It was so cool. I got to see the Vinci robot in action, which is really amazing. This is a robot that is used for minimally invasive surgeries. Basically how it works is the surgeon sits at a console and they move controllers in order for the robot to be controlled, and the surgeon sees a live image of what's going on inside of the patient. And then over at the patient, there's a few holes that are made rather than large incisions. The instruments come in through these holes and they do the cutting, snipping, cauterizing as controlled by the surgeon. I got to learn about coronary artery bypass grafts. So let me tell you what I learned. Basically, the coronary arteries supply the heart, and sometimes they get blocked. If they get blocked, the heart muscles don't receive enough oxygen to pump, and you are at a high risk of having a myocardial infarction, also known as a heart attack. So in order to prevent this, if they see that there's blockages in the heart, they will bypass the blockage either using a saphenous vein, which comes from the leg, or using the mammillary artery, which comes from sort of the inside of the chest wall. So with the Vinci procedure, they use the mammillary artery because it's nice and close to the heart, and it's also an artery, so it's better suited for sort of replacing the job of the coronary artery over the vein. Alright, so it's 11, I'm heading to bed, and I will be back up tomorrow at about 5 in the morning. Tomorrow I am shadowing plastic surgery. Alright, so I'm at the hospital. I arrived a solid 40 minutes early. I don't have to technically arrive till 7:30, and the surgery doesn't start till 8, so a little excessive on my part, but I have a feeling I will not be getting lost today because I've been to this hospital before, so I'm not too worried. I've been to the OR here before, so that part is not as stressful because yesterday I got lost. It took me a solid half hour to figure out where I was going. So today I shadowed plastic surgery. It was amazing. I have shadowed plastic surgery before, so it wasn't like a completely new experience, but the person I was shadowing specializes in breast-related surgeries, whether that be augmentation, reduction, repair after a mastectomy, or nipple reconstruction, which nipple reconstruction I did not know was a thing, but it's a really, really interesting procedure. So sometimes when you have breast cancer, when they take out the lump, depending on where the cancer mass is located, sometimes they have to take the nipple out with it. And now with plastic surgery innovations, it's possible to use like skin flaps that are not nipple in order to construct a nipple, and it looks really realistic. And I guess it's something that's really important to some patients from like a psychological point of view, and just kind of helps round out the fact that they're healing and they've recovered and become cancer-free. But the most wild part of my day was not the nipple reconstruction. It was that I got a needlestick injury. So I'm not going to go into the details just because of patient confidentiality, but basically in the OR there was a situation where something poked me that had been in the patient, and obviously there's huge potential for blood mixing as well as spreading of blood-borne diseases. So as part of applying to medical school and getting into medical school, you get a ton of immunizations, but you also get blood work reviewed and done and looked at so that you kind of know your status on these diseases and you're protected in the best way possible against these diseases. However, the patient status is often unknown, as well as whether they're up to date on their immunizations. So there's a ton of work that needs to be done in order to maintain patient safety as well as safety of the healthcare worker that got poked. That being said, I get escorted by a security officer of the hospital to the emergency room. I get admitted right away. I get all this blood drawn, I have to give a urine sample, I have to answer all these questions, fill out a whole bunch of forms, I get prescribed on a bunch of medications. So it's like a little scary that all of a sudden you're like shadowing, la la la, doing your thing, and then bam, all of a sudden you're a patient that's getting like admitted into the hospital, and you're having to be like interrogated, and you have to fill out all these forms, and you're like giving all your blood. So yeah, in speaking with more people, they were like, I broke down and cried the first time this happened to me, or like, I was just so overwhelmed. So yeah, the more I've talked about it with other people, the more it seems it's a pretty common occurrence. Obviously you don't want it to happen, but sometimes things are out of our control and mistakes do happen, and that's why we have policies like this in place to ensure safety. But those policies and going through with those can be very overwhelming. The anesthesiologist came out and she was just like, you know what, this happens to everyone. It's just a question of when it's gonna happen, not so much whether it's gonna happen. And just hearing those words that like, this happens to everyone and you're not like a total failure of a person was really, really comforting. So that's why I'm saying that it happened to me, so that when it happens to you, hopefully you're not as overwhelmed. So I've laid out all my clothing for tomorrow down to my undergarments, just so I don't have to think about this at 5 in the morning. I have also pre-set up my breakfast with my toast, plate, smoothie of things that don't need to be in the fridge. Everything else is in the fridge. And of course, cafe! Good morning. It's about 5:15 in the morning. I'm just chilling in the rain at the bus stop, and I am heading over to the hospital to watch vascular surgery. I'm at the same hospital as I was for cardiac surgery, so hopefully I don't get lost. And yeah, I have no idea what to expect because I don't really know what vascular surgery is. It's another day at the hospital. I arrived, I made it, and I was ready to go at 7:15, walk into the OR, and literally nothing is happening yet. Like, nothing. So I'm taking my pills, having a coffee break, and just waiting around. Sorry for the unattractive angle, but I just had the greatest day ever. So today was my favorite day of shadowing so far in vascular surgery. I got to see a really serious case. It was a AAA repair, so that's an abdominal aortic aneurysm. Basically, your aorta carries a ton of blood and delivers it to your body, but it can have areas of weakness, and in these areas of weakness it bulges out, and because of this bulge you are really high risk of the aorta rupturing because the walls of the aorta in that area get weaker. So this repair is super important, and it's also like very intense because obviously you're dealing with a situation that is life-threatening. But basically, yeah, they put in a graft and re-sew up the aorta so that it is stronger and less likely to rupture. The surgeon was also amazing, and I think something that's challenging in seeing all these specialties is that it's hard to tell like if you actually like the specialty, because you literally see one day and it's in the OR. You have no idea what the rest of the specialty looks like, and I think it's easy to get like persuaded one way or another based on your interaction with the surgeon and how much you liked sort of that teaching style and like the whole shadowing experience that they provided. Good morning. It's another early morning waiting for the bus. So I'm at a new hospital today, hoping, praying that I do not get lost. And today I'm going to be shadowing urology. Alright, so I'm done for the day. Today was urology, which was, let's say, interesting. So I'm home. Let's talk about urology. What the heck is it? I really wasn't sure until today. Basically, it's like obstetrics and gynecology, but for men and the male reproductive system. So, today I said was interesting, and I think thinking about it now and reflecting, the problem was vascular surgery was just so exciting. We saw some really intense stuff that required fast action and teamwork and just like adrenaline. And then urology was slow and steady wins the race. So for example, in vascular surgery, if a major blood vessel is leaking, you gotta like suture that thing up ASAP. Whereas in laparoscopic urology procedures, it's really hard because you're going in through these weird angles, you're looking at a camera, and you're trying to do these intricate procedures from like a remote kind of setting. And so you kind of watch someone else try to stitch up some tissue, and what would take like 2 seconds in an open procedure takes like 10 minutes. This is absolutely no criticism to the urologist I shadowed. He was incredibly skilled, and he was also a wonderful teacher. He really explained everything that was going on, walked me through scans, but in terms of like actually watching the surgery and vascular surgery, which was literally yesterday, there's like blood squirting everywhere and people like, oh my god, like trying to plug it and like sew it up fast. Whereas in urology, it's just like, you gotta be slow and steady because you're working in this really technically hard environment. But as an observer, it's just like, all right, I'm gonna watch this slow procedure. Good morning, it's 6 a.m. and today we are shadowing cardiac surgery! So today I got to see my first open heart procedure, which was really interesting because last time I went to cardiac surgery it was done robotically, so they just had like holes in the chest and went into the heart. But in this case they cut the chest open, split it open wide, and you can see the heart in the middle pounding. That was really cool to see. Unfortunately, the surgeon was not really in a teaching mode or mood. He had another medical student, another resident, he had an assist. So like obviously I was very bottom of the pecking order. that being said, I have been bottom of the pecking order before, and usually the surgeon will explain things and sort of include you in conversations, speak to you, you know, ask what your name is. This guy, no, not really. I think he said like a total of 5 words to me. I wasn't really learning a lot. I couldn't see a lot. So I just left after the first procedure. Unfortunate, but you know, you kind of never know what these sort of experiences are going to be like. And I understand that surgeons are busy and they have other people they have to teach and they just have a lot going on. So I think it was just unfortunate timing, and it's too bad that I didn't get more learning out of this experience. But I did learn sort of what not to do when I am a future doctor and have people shadowing me. Hello and welcome to week 2 of the shadowing extravaganza. So today is spinal neurosurgery. I'm hoping that I kind of have an idea of what's going on after having done my flex project. I'm a bit early, so I'm going to grab a snack before putting on scrubs. I often find sort of halfway through the first surgery, my stomach is like, feed me. And I think that's because I've been waking up at 5 and eating at 5. Alright, well that is a wrap for today. Super interesting seeing spinal neurosurgery. The dissection that I did in flex was very different than surgery. It was almost not helpful in understanding what was going on. But yeah, very interesting day, and the doctor today was just really amazing at going through like the CT scans and explaining everything that was being done, and just pausing the operation every now and then to let me like have a look and point out different structures. So I'm so appreciative to the preceptors out there that are wonderful teachers, and hopefully I can just take their pearls of wisdom and sort of replicate them when I am one day in their position. So today I was shadowing spinal neurosurgery, and I learned today that you can become a spinal surgeon 2 ways. You can either go orthopedics and then spine fellowship, or neurosurgery spine fellowship. Good morning. So today I got to sleep in a little bit because I'm shadowing at a clinic rather than the OR, so it starts a little bit later, and sleeping in just felt amazing. So today I'm going to a vascular surgery clinic, which I'm really looking forward to because I will get to see the more medical side of this surgical specialty. And honestly, the reality is surgeons are only in the OR for a fraction of their work time, and the other aspect is in the clinic, where they are looking after patients pre-op, post-op, or deciding whether or not the patients are appropriate candidates for surgery. So today I will see that in action and hopefully just get a better idea of what a vascular surgeon actually does. I learned a lot of interesting anatomy and physiology of veins and arteries today, but I think the most common thing, based on my 1 day of experience, was varicose veins. So varicose veins, you've probably seen them. They're most commonly seen in the legs, and I think they're more commonly occurring in females, but basically they're these big, swollen, bulging out, squiggly veins. There's a few ways that you can repair them, but basically you want to find the root cause, which is basically the leaky valve that's causing all of the backflow. And if you can either chop that out, or burn it shut, or glue it shut, you prevent any backflow going back and causing swelling in those varicose veins. So by eliminating the leaky valve, you're essentially turning off the tap, and the veins underneath are no longer filling with blood, they're no longer becoming swollen, and over time the varicose veins disappear, so long as you've identified the proper leaky valve. Good morning. So I'm on my way to the hospital once again, and today I'm going to see a kidney transplant. I'm so excited. If you watch my vlogs, you know I love kidneys. So yes, I'm very much looking forward to today. Alright, so it is the final day of the extravaganza. It's been a good experience, but to be honest, I think I'm ready for it to be the last day. I think 2 weeks was kind of overdoing it. Well, that is a wrap on my 2-week shadowing extravaganza, and I am officially done with doing anything remotely related to school until I start second year, which will be at the end of August. So I'm taking the next month off, and I'm not thinking about anything medicine related. I'm just gonna clear my brain, relax, and I just want to come back refreshed with like some new motivation and some new drive. So over the next month, I will be spending time in Japan, and I may make a video on something related to that, so stay tuned. But otherwise, I will be back with the vlogs when I start second year. I can't wait to be awkward and try to do med school and vlog it. So I will see you in the next video.